My name is Dr. Luke Crantock. I'm from the Centre of GI Health, and I have the privilege of working with 8 outstanding gastroenterologists supported by very dedicated secretarial staff and some truly wonderful nurses that work with us at our new endoscopy centre and officer. Gastroenterologists are involved in the management and diagnosis of digestive disorders, and to do that a lot of our work is taken up in consultation and physical examination, but we also use endoscopy to try and help determine a diagnosis. Endoscopy has a Greek derivation, endo from within, and the word scopy, which means to observe, usually with some intent. And the very first endoscopes really date back to the 19th century. They were semi-flexible instruments with poor optics and really weren't particularly useful. And in 1951, an optical physicist called Harold Hopkins was at a dinner party in London, and he was talking to a gastroenterologist who was a little bit upset about the lack of finesse of the instruments. And what the gastroenterologist really wanted was an instrument that was flexible, had good optics, a good light source, and enabled the tip to be manipulated in many different directions so that the gastrointestinal tract could be thoroughly examined. So Hopkins went away and thought about that, and he knew a little bit about the Renaissance Venetian glass blowers and how they bent light around corners in glass, and he started experimenting with narrow tubes of glass. And in 1954, he published his prototype in Nature, a flexible prototype of the modern endoscope. Now, there's a bit more to the story because that article was read by a gastroenterologist in Michigan in the United States, a South African gastroenterologist called Basil Hershowitz, who then flew to London. He found Harold Hopkins very helpful, and after discussion they took that idea back to the United States, and Hershowitz worked with some collaborators, and in 1967 they came up with the modern endoscope. And since very early endoscopes we now have quite advanced instruments, and here's an example of an instrument that we use to examine the upper digestive tract. And this instrument can be moved in many different directions, forward, back, left and right. It can be rotated. It has a very powerful white light source, but sometimes we use other forms of light depending on the pathology we wish to examine. It has an air source as well, so we can inflate the digestive lumen with air, but we also use carbon dioxide, which is rapidly absorbed, and it makes it a bit more comfortable for patients. There's a biopsy channel through which we can pass single-use instruments like biopsy forceps, snares to remove polyps. We can apply injections, so we can tattoo an area if we're interested in coming back to where it was. We can use clips, we can use glues, we can use sprays. It's unbelievable what we can do, actually. Lots and lots of things that we can do.